A very warm day to good day to one and all. It's a pleasure and a privilege to meet you on this platform. Today we talk about disorders that are associated with sleep. Sleep is often something that we take for granted. We never really look at problems associated with sleep. Some of us don't even understand whether sleep could be problematic at all in the first place. But I think we must be reminded that there are very clear sleep disordered breathing disorders that are associated with sleep, and one of the commonest disorders associated with sleep is sleep apnea. And sleep apnea is something that we will touch upon today, because I think it's the commonest affection as far as sleep related disorders is concerned. So what is sleep apnea? Sleep apnea is characterized by a couple of things. One, it's characterized by extreme daytime sleepiness, and I think this is one of the characteristic features. You will find people watching a television and just drifting off to sleep, and I think you will find these patients going off to sleep without their knowledge at all. Inadvertent sleep is what we are looking at. That's point number one. Point number two would be excessive snoring and stoppage of breathing during sleep. Not only will they snore, but they are sleeping, but their breathing will stop for a short duration of time, about 10 to 15 seconds. And that's the reason why we use this word called apnea, which means that you stop breathing. Stoppage of breathing is called apnea, and hence the word sleep apnea as such. So basically, sleep disordered breathing is associated with a couple of things. It's got a greater association of females, patients with obesity for that matter, are very, very prone for sleep apnea. Patients who are very docile, who don't really do much of physical work, they are extremely prone for sleep apnea. Patients with diabetes mellitus and obesity together, I think, are very common complex where you get obstructive sleep apnea. So these are the backgrounds in which you get obstructive sleep apnea in the first place. So once you think of obstructive sleep apnea, which is OSA as we often like to call it, how do you make a diagnosis of OSA? You make a diagnosis of OSA by doing what is called a sleep-related study. A sleep study which can be of multiple levels, but I think a simple screening sleep study that you do at home, an overnight sleep study done at home, is good enough to diagnose more than 60 to 70% of patients who have sleep apnea and put them on the proper treatment. Then you calculate multiple indices. I don't think we'll go into all that. Like the AHI, for example, is a very classic index of the extent of sleep apnea that you have. And once you have that, you can use what is called a CPAP. So what does a CPAP do? A CPAP machine just forces air into your lung and compensates for the pressure that is associated with the closure of the organs that are organs of breathing, where you take less air inside, and because of the less air inside, you have an oxygen drop, and that's the reason why you wake up during those times, or you get this extensive snoring. And once you start the CPAP, which means you're pushing pressure against resistance, the CPAP will mean that your breathing will become more organized, your snoring will stop, your quality of sleep will improve, and your whole lifestyle will improve as such. One of the common accompaniments that we see with patients who are started on CPAP is a weight loss. For some reason or the other, weight loss is a common thing that is associated. Your mental alertness, your mental frame of work, all these things will definitely improve. So if you think you have a sleep related disorder and a sleep apnea, please do not think that this is the end of the world. It is not. It's a wonderfully treatable problem that once you use a CPAP machine, there will be a huge transformation in your lifestyle itself. Whether it is sleep, or whether it is cognizance, or whether it is associated work, whatever, mental work, physical work, all these things will start improving. So I think ultimately the awareness of sleep and sleep related disorders is the most important thing that we need to look at today. And when you look at sleep and sleep related disorders, I think you need to think about the conditions we have already talked about today. Remember them, try and see if you can place them in your practice, and pick up these patients and create awareness in patients that there is something called sleep disordered breathing, which can result in a lot of problems, including sleep apnea, which can be very, very difficult on occasions and sometimes cause a lot of problems. The real complications of sleep apnea would be cardiac complications, would be complications related to plain obstructive sleep apnea where there is obstruction of airflow, You could have arrhythmias, that is a disordered heartbeats during these courses of sleep apnea that you have. So there is loss of cardiovascular and respiratory morbidity and mortality that is associated with sleep apnea. And all these things can be organized very nicely when you use a CPAP for the whole. You'll have a clear reduction in the volume of the problems that we have. So we have a problem, we also have a solution. And to sort of marry the problem and the solution together is the question of bringing awareness in the middle. Between the solution and the problem is the awareness which really makes you go for the solution. And once you get the solution, I think a CPAP will really change your outlook on life and make you feel better. Thank you very much for the patient listening.